Hello, and welcome to another episode of Kitchen Table Gist, where the gist is always hot and the stories are always real. I'm your host, Abba, and today I have a very beautiful guest in the kitchen with me. She's a health practitioner, a registered nurse. She's a mother of three beautiful children. She's also a travel enthusiast and a fashionista. Her name is Amaka.
Thank you. Thank
Welcome to the table.
Thank you so much for having me.
How are you doing?
I'm not so bad, thank you.
I'm super excited to have you in the kitchen today, honestly, because I know your story is one that's going to be so inspiring. It's going to be moving. And even though I don't know the full gist, and we're all going to find out at the same time, I can't wait to dig in. So,
bring it on.
Please tell us a little bit about yourself.
So, as you all know, my name is Amaka. You know, I've got three beautiful kids.
Yes.
I'm a registered nurse, and I've beaten cancer twice.
Wow.
And I've also dealt with mental health issue like depression, anxiety as well.
Wow.
And I survived.
Wow. Wow. Honestly, Amaka, with the little I know of your story, I can testify and say that you are a living miracle.
Yeah, thank
you.
you.
Are, honestly, and you're so strong, and you are the definition of we don't look like what we've been through.
Exactly. Yeah.
You are that. I can say that for a fact. So I want you to take us through your journey, in your recovery journey, your diagnosis of cancer. Just talk us through, where were you when you found out, or what prompted the visit to the doctors to find out that you had cancer?
So I could remember vividly that fateful day. I was just having a shower in my while I was, I don't know, it's like a normal routine for me. I normally check my breast, and I found the lumps in my right nipple, covered, very massive lumps covered in my right nipples. So I was a bit curious. Then I wasn't a nurse practitioner. I was just a HC working as a healthcare assistant. But then again, I checked my left breast. It was very unusual, and I remember vividly asking my ex, this is very unusual, that I needed to see the doctor and all that. And we were like, okay, let's just visit the doctor. So I reached out to the GP, and they booked me with a nurse practitioner instead of the doctor.
Okay.
So I saw the nurse, and she was like, oh, it's nothing.
Oh, really?
Yeah, that was what she said. It's nothing. It's just a boy. You know what boy is? That's
boy.
Yeah. She was like, I was going to give you antibiotics. That will help. The reason why I refused antibiotics, I used to have this tonsillitis, very, very intense tonsillitis. Okay. So I was in the hospital like 3 weeks previous, prior to going to the GP, and I had those 12. I think 7 days of antibiotics I had. Wow. Yeah, I completed that antibiotics. Those already. I'm like, no, I'm not having that antibiotic. She was like, we argued a lot. And she was like, okay, if you really want to see the doctor, I'll book you. There's no harm in trying. And she booked me with the GP. And the next day, the doctor called me in, and she looked at me and she was screaming. And she was like, no, this cannot be boy. And immediately she referred me to the Nightingale in Winshaw. Wow. Yeah, so, and they acted fast. Just 2 days after, they called me and they did all the mammogramming, biopsy. My surgeons sent me to MRI and scan and CT scan, where they will visualize everything to see if cancer cells is, though they've not really told me that it's cancer, just to see if anything abnormality is there. So they now sent off my biopsy. Then they asked me to come back within 7 days. When I came back, I went alone, and they called me in. They were like, did you come with anybody? I said, why? She said, anyway, when I saw the doctors, they were quite much in the room, like 2 doctors, like another 3 nurses.
Wow.
Yeah, they were quite much. I'm like, what's going on? The doctor was like, my surgeon was like, Gloria, what I'm about to tell you, don't panic. She said, I have good news, I have bad news. She said, good news. I said, well, she said, I remember him asking me, what do you want to hear? Is it good news or bad news? I said, let's start with the bad news. At least the good news, at least will help me a lot. You know, said, oh, the bad news is that the thing came back cancerous.
Wow.
Yes. And I'm like, are you for real? So when he told me that it was cancerous, you know what was going through my mind? Oh, it's my turn to die.
Oh my
God. Because previously my brother-in-law died of lungs cancer.
Oh,
he didn't make it. In fact, he was diagnosed very, very late at stage 4. So they've already given him a date. So when my surgeon told me it was cancerous, I'm like, okay, it's time for me to die. Then he was like, relax. I couldn't say anything. I was so dumbfounded, like, I couldn't say anything. I was just staring at them. He said, do you want to hear the good news? I said, okay, just tell me, what's the good news? He said, it's treatable. It's a stage 2.
Wow.
So I was so relaxed. He said, because you are my youngest patient, I'm going to act fast. I'm going to give you a date for mastectomy, the removal of my breast and reconstruction. And then I will refer you to the oncologist, because oncologists deal with the cancer. So, which he actually did. He before you knew, they gave me a date. I did operation. That mastectomy took almost. He told me initially the plan was removal of the breast and reconstruction was going to take, like, let's say, give or take 12 hours.
Wow.
Yes, but it took almost, like, if not 16 hours.
Wow.
Yeah.
Can I just stop you there for a second? So for some viewers and for somebody like me, I know of mastectomy. I know it's a procedure to remove, the cancerous cells or the cancerous tumor, but I don't really know what that means. So can you break it down? Does that mean they cut off the boobs? What exactly do they do? What
they did with mastectomy, they will cut off all your boobs, scrape off the cancer cells, even because the cancer actually spread to my lymph node, which is the axillary. So they scraped up everything. So because I was the youngest patient of my surgeon, he was like, I would have left it like that, but because you are still young, I'm going to do a reconstruction, immediate reconstruction. So that was when he did reconstruction for me. That was why the surgery actually took so long. So what they did, they took a flap from my back. I have a very deep cut on my back, like a scar. Anyway, I love the scar. It reminds me of how strong I am.
It's your victory.
It's my victory. Yeah. So they took a flap from my back and reconstructed a new boob for me.
Oh. Okay.
Yeah. So what they did, they left the nipple. It was on a later day they reconstructed the nipple. So
I see.
Yeah. So I actually I recovered so fast, and everything wasn't within sure. I think after 1 month I recovered, and they referred me to oncologist, the Christies. That's when the race journey started.
Wow.
When they tell you have cancer, obviously the fear could kill you, because you don't know if you survive. But another thing that could kill someone is chemotherapy.
Wow.
Yeah, the first thing on the consent of chemotherapy is death.
Wow.
Yes, it can kill you because it can lead to cardiovascular problem. You can have cardiac arrest.
Wow.
Yes, it could kill you. But with me, I was so lucky, even though the side effect was so intense. I couldn't eat. I was vomiting.
Wow.
My immune system was very low. I was having attack, attack. Like my immune system was really down. I was always in the hospital every now and then. They were always admitting me. In fact, in a week, they know us in that area. Ambulance always come to my house. They'll just I'll be admitted and they'll treat me with some antibiotics. Anyway, I had the first 3 doses of my chemotherapy was really bad. I couldn't manage. I could see myself going. Honestly, yes.
When they say chemo, what's that? How
So,
does that look like?
Chemotherapy is like a drip. It comes like a form of drip. What chemo does, it attacks your good immune system, also attacks your bad immune system, and leaves you empty. That's what chemo does. So I lost my hair.
Wow.
I lost everything. I lost my nails. I lost basically. I was empty. But I bounced back anyway.
Wow.
Yeah. So after 3 months, they changed my dose of chemotherapy because I was reacting really bad to that particular chemo one. So my oncologist was like, okay, we'll try you on every week one. Honestly, I actually prefer the every week one because the adverse side effect was not that strong as the first once in a week. Once in a month. I can't remember. It's been ages. Because my first diagnosis was in 2014.
Wow.
So that's ages ago. Anyway, I beat that one and I had a reoccurrence. Anyway, I omitted something.
Okay.
Before I had chemotherapy, because I was still young and my GP was, and my surgeon was like, you might want to have another child because I only had my 2 girls. He was like, I think you need to freeze your eggs, and he referred me to St. Mary's. Anyway, the multidisciplinary teamwork was too much, so they referred me to St. Mary's where they froze your eggs. It's like the process is like, you know, when you want to do IVF.
Yes, they collect the eggs.
So I have to inject myself for the egg to be matured, and they collected the egg. Up to now, I still have like 4 frozen embryos in the freezer.
Wow.
Yeah, but then I didn't use that embryo for my son. That's I'll get to that story. So after I recovered from chemotherapy and they brought me back for for the nipple reconstruction. You know, when they did mastectomy, they had to put a silicone to record because I was a very thin girl. They could not get enough, fats to reconstruct it. So my my surgeon has to put silicone. I was reacting to that silicone, so I have to go in again for them to remove the silicone. And they just left the breast with the normal fat, So they now called me for a later day and they reconstructed my nipple. Honestly, if you see it, you think it's natural. Wow. You will not even have any clue that it's reconstructed, man-made boo. Anyway, so I was happy that I was beating cancer and boom, I became pregnant. I wasn't seeing periods. I wasn't ovulating. I just noticed one day that I was bleeding really bad. I was bleeding so much. I was like, is it that my period is coming back and all that? So I'm just so curious. I went to the A&E in Rodenshaw Hospital, and they took my blood, and my gynecologist was laughing. He said, your HCG is high. I said, what do you mean HCG is high? He said, I think you are pregnant in your mind. You don't know what you are saying. He said, okay, I was going to admit you so that the sonographer will just scan you and see if they have any heartbeats. And boom, the next morning, there was heartbeats growing in my tummy. I'm like, this can only be a miracle. Then the journey again continued. My gynecologist was like, because I was on medication, I was on cancer medication. Because if I decided to keep this pregnancy, it might affect this child because the cancer medication is very strong. And I'm like, say, you don't know how God works. So me, I'm keeping this pregnancy. So you are just saying your own, I'm going to keep this pregnancy. He now gave me like 3 months. He said, no, it was 3 weeks. He said, just go home, think about it if you really want to keep this pregnant. And he said, however, if you choose to keep the pregnancy, it's all on you. I'm not going to say anything. I said, I don't have anything to think about. It's just
the baby.
I said, that child is a blessing to me. I'm keeping the baby. And that's how I kept the baby. I was managing, because during that period, my mom died. I went to Nigeria with the pregnancy, but nobody knew. I was managing. I could remember vividly on the 1st of January 2019, my water broke. Where everybody was happy New Year.
Oh,
I was
wow.
there crying. My water broke. I'm like, is that the end of this pregnancy?
How far into the pregnancy were you when your water broke?
6 months.
Wow.
It was-
So you were not even.
No, I was not really far gone. So when I went to they took me, I called the ambulance, they took me to Woodenshaw Hospital, and they said the water is already broken, that probably I have to give birth premature. But there's still a lot of water to manage that embryo or baby, whatever, and that they just have to keep an eye on me. So they have to move me to St. Mary's, because they said in case I give birth, because obviously it's premature. Woodenshaw doesn't have the facility to keep that child. The only hospital that has the facility in Greater Manchester is St. Mary's, and I think they said Liverpool, and St. Mary's was closer to me. So I chose, even though I don't like St. Mary's because I lost a child, it was through St. Mary's, my second child. So anyway, that's another story. It's been
God.
So I was quite adamant. I was like, I don't want to go to St. Mary. They were like, you just have to go for your child's sake, and even for me. So they monitored me. Anyway, I agreed. The ambulance took me to St. Mary. They monitored me for like 1 week. I was in St. Mary's for 1 week. So they now sent me again for scan. They now found out that there was no water in my tummy anymore.
Wow.
So basically, my son was just there, empty in my womb. So they were like, they have to take action. They now discharged me that day. I don't know why. The reason why they discharged me, I don't know. So when I go home, I remember not feeling my son kicking anymore.
Oh my God.
So I have to call the ambulance, and they rushed me back to St. Mary's. And I remember when the doctor saw me, he was like, you have just 5 minutes for us to do you emergency CS. He said that if I don't do you emergency CS, he said that you die or your son, in fact, both of you lose your life.
Oh my God.
Yes, you needed to see how they were running helter-skelter.
So why did they discharge you in the?
That's what I don't know.
Understand.
I really don't know why they did. Anyway, got into theater. They normally use epidural instead of general anesthetic.
Yeah.
When they did the epidural wasn't working for me.
Wow.
So they keep trying. Epidural wasn't working for me. So the doctor was like, you know what? We have to make critical decision. They have to knock me off. Just
straight away.
That's it. They knocked me off, and I wasn't awake when my baby came. Anyway, they were able to save him, even though they told me that he has 50-50 chance of surviving. That child is my miracle. I love him to bits. That he has 50-50 chance of surviving. He was in NQ for like 3 months plus. Then we stayed in St. Mary's for 2 months, and they now have to move us to Woodenshaw, because Woodenshaw have a bit of stability when it comes to NQ and premature children. And they sent us home with oxygen. My son was on oxygen for 1 year.
Wow.
Anyway, he's now a big boy. His mommy's baby.
Wow.
All right. Prior to me having my son, I noticed lumps in between my 2 breasts at the middle of my chest, like.
So wait. So let me understand. They've done the vasectomy. You've had chemo. You were in recovery. You found out you were pregnant.
Yeah.
And then while pregnant, you found additional lumps.
Yes. Not while pregnant. After having the child.
Okay, so after you had your son.
Yeah. After I'd had my son. Mind you, I was not cleared anyway.
Right.
Yes, I haven't been cleared. They've just been managing me, with medication, hormonal therapy, because they said the breast cancer I had was hormonal breast cancer.
What does that mean?
Yeah, it's like the hormone, like my hormone.
It's over-generating.
That's
it's
it.
Over-secreting and
That's
it's
it.
creating the lumps.
The lumps, yeah. It's
right.
Yes, it's actually making the cancer more aggressive and all that.
Right.
So
oh my God! And then you became pregnant. And
then-
that's going to accelerate it.
it now triggers everything. So
got it.
yeah,
Okay.
yeah. So the hormone actually triggered my second reoccurrence. So I found the lumps again. I said, went to the GP.
Again.
Like the first time, the GP referred me because being that they know my past medical history, they actually did referral very fast. Then when I saw my surgeon, he was like, Gloria, what are you doing here? I said, I don't know. I found the lumps again. He said, okay, we'll do our investigation. They started all over again, mammogramming, a biopsy, x-ray, and everything. It came back cancerous.
Wow. How did you feel in that moment?
I said I can't be asked.
Like, because you've been through so much.
Yeah,
I can
honestly.
imagine. You've been through so much.
Yeah.
You just had your son.
Yeah.
And it's like this again.
Again.
Like,
I couldn't even care. Like I said, what next? That was what I said. I said, Mr. Murphy, what next? He was laughing. He said, okay. I said, the only thing I'm dreading is chemotherapy. I can do with everything, but chemotherapy, I don't think I will survive chemo this time around because I'm old now. I'm really old. Honestly, I don't have that stamina anymore. He said, it depends on how the result comes back, because what they did, they took the tissue for further investigation. So he said it depends on that result. When the result comes out, that's when they will think if they will know if I will have chemo or not. And I said, okay, finger crossed. I was just praying to my God. Then he referred me back to the oncologist, the same oncologist that treated me initially. I think Dr. Armstrong. Yeah, I can't forget her name. She's a she. So when the results came, they were communicating. Obviously, multidisciplinary. They communicated with each other, and the results came. They had the multidisciplinary meeting. They found out that she can actually do away with chemo.
Oh,
yes,
yes.
yes. When they informed me, I was dancing. Me that had cancer, I was still dancing on top the news.
You didn't want the chemo.
I don't want the chemo, so So that was when my journey started again. So they said instead of the chemo, I would rather have radiotherapy because my first diagnosis, I didn't have radio because I had chemo. So radiotherapy is another one. But it's not as severe like chemo. Radiotherapy is like when they bring out like a radiation, very high volume of light
to kill
the cells. Yes, but even though it damages some of your nerves, yes, it has its own side effects. So the radiotherapy, so they booked me for the oncology team and they gave me a date, took the blood sample because they have to do your blood sample if you are you have the stamina, if you have the energy enough to take all those treatments. And every week I'm always going to Christie's Hospital. Then the radiotherapy is a huge one, even though it's not as severe, but it's a huge one because you have to be going to hospital every day for 6 weeks.
Oh my God.
That's how I was going to Christie's Hospital for 6 weeks for radiotherapy. But before the radiotherapy, they have to have, instead of mastectomy, because I've already had mastectomy, there's something called lumpectomy.
What's that?
They just remove the lump.
Okay.
Yeah, so it's called lumpectomy. So they took out the lump. I still have scar in between my breast. Anyway, I love the scars. It gives me joy. Yeah, so they did lumpectomy. So when they did the lumpectomy, they took the sample for further investigation. Then they came back. They said there are some cells remaining again in between. They have to take me back
and take them all out.
And take them all out. But trust me, I enjoyed my first surgery because instead of Widenshaw, they took me to a private hospital. Ooh. It's called Inspire. It's like you are on holiday. You needed to see the suits. Oh my God. I have a video of it. Their food is like I don't know how to put their food. 5-star hotel.
Like a 5-star hotel.
Yeah. It's not like hospital environment at all. So I actually felt better and I recovered really fast. And so I started my radiotherapy journey, and 6 weeks I was done, but trust me, it was the longest 6 weeks of my life. Imagine going to hospital every day. The only time I take break is Saturday and Sunday. Every blessed day, you are under this volume of, lights. So anyway, I went through that and I survived. Then they now had a meeting. They came together, all the multidisciplinary, they came together. They now said, okay, how are we going to prevent this from reoccurring again? They had their meeting, they deliberated, and they found out that, okay, since it's this hormone that is actually the issue, why not do hysterectomy? You know what hysterectomy is?
Take out the womb.
Yeah, the removal of everything. You remember, there's this lady, Angelina Jolie.
She did it.
She did it. She took everything. She did because they had BRCA gene positive, and when they did test for me,
it was you had BRCA gene
positive. So they now suggest. I said, bring it on. I'm not going to have any baby anyway. I don't want to go to that journey anymore. So, they referred me to gynecology because it's their duty to do the hysterectomy, not my surgeon anymore. So, my referral was misplaced. For 1 year.
What?
I'm telling you, for 1 year, I was waiting for this referral. I was waiting for them to send me a letter that, okay, we've gotten your referral. I didn't.
Nothing.
So I was already telling my cousin, I said, since they've already mentioned this hysterectomy, I'll probably save up and go and do it privately. And since I was like, you've worked so hard for NHS, you don't have to save up. So luckily for me, I used to work in gynec team. So I spoke to my matron. I remember me telling her that they've referred me to this team and I've not heard anything about them. She was like, leave it to me, Gloria, I'll sort it out. So she changed it up. Under 2 days, they called me.
Wow.
I'm telling you, they called me and that was how they gave me a date, and I had my second reoccurrence was in 2021. Did my treatments, healed, I healed from the treatment, I recovered. Then my mastectomy, I waited for my hysterectomy, I waited for like two years. I did my hysterectomy in 2023. Yeah.
Wow.
Yeah, I did my hysterectomy in 2023. April 2023. So they did the removal of my everything, including service. I don't have anything.
Wow.
Oh, trust me, it's been the best decision of my life. I've got 3 beautiful kids.
Yes.
I'm not planning to have another child. So yeah, that's my story.
And even if you wanted to have another child, you've got your eggs.
Exactly.
Surrogate route.
Yes,
so
I've got eggs. I'm not actually losing. I still have my eggs. It's still there stored in the freezer. So yeah.
Wow, that's brilliant. Oh my God, your story is so touching.
Thank you.
Because I do know that you're a cancer survivor, but I don't know the details and the ins and outs.
Yeah.
So this journey has been from 2014.
Yeah.
Oh my God.
It's been a long journey. It's been a long journey.
God. And it's a testament to your strength.
It is.
How you are able to even make light of it.
Yeah.
You danced when they told you didn't have to have chemo.
Yeah. I was laughing.
You were comparing the private hospital to a 5-star hotel. And honestly, and it just shows how strong you are, because a lot of people will give up from the depression, not even the sickness now.
Exactly. I was depressed. Like I was saying, I survived depression. I was depressed at the time. Like, why is this happening to me? What have I done wrong? Has God forgotten me? I was quite depressed, like even having suicide thought, like. And then again, I said, this life is too sweet. Why would I want to kill myself? Exactly. I just have to beat this cancer and bounce back again. Yes. And I'm happy I didn't even, listen to that voice.
Yes.
That
negative voice.
Negative voice.
And what will happen to your kids?
Yeah. So
wow.
that was my story. And why I can count myself lucky, because the cancer was detected so early. Honestly, early detection is the key. Is the key. If they detect it early, if it's stage 1, stage 2, obviously you can survive. Stage 3 is like 50-50. Stage 4 is nothing. So I've been so lucky. The twice I've had cancer is either stage 1 or stage 2. and my multidisciplinary team, like the kind of holistic care they've been giving me, like
Wow.
now that I'm a nurse practitioner, I know how well they actually
They
looked after me.
you.
Yeah, I'll count myself one of the luckiest people on this earth.
Wow.
Yeah.
That's amazing.
Yeah.
Oh my God, your story is so moving. You know, when people are going through stuff, you think about things, like you are the one going through it.
Yeah.
You're going through the sadness, the suffering, the emotions, the healing, and all of it.
Yeah.
How did it affect your family members? Because I can imagine living with the fear that, oh my God, I'm going to lose my sister.
Of
oh my God, I'm
course.
going to lose. You know what I mean?
Yeah.
That possibility, they might not voice it,
Yeah.
but they are thinking it.
Yeah.
What were they like? Like, how was it for your family?
Like my mom, I have so rest in peace. My first diagnosis, she was still alive. She was like, oh, she was so worrisome because she obviously she lives in Nigeria. I couldn't invite her, because we were still on, my ex was still on student visa while I was a dependent on him. So I couldn't invite my mom. She was worried. She was always calling me, what are we going to do? Should I send you? She believes in Agbo. Should I send you Agbo? Should I do this? Should I do? I said, don't worry. I'm in a safe hand, mommy. But then she doesn't sleep. She's always calling me. Then my two girls were very young. I don't think it affected them now. It's not aware. They were not aware of what was going on. But now they've grown up. They were like, oh, mom, this was what you went through. You actually went through cancer. They taught them about cancer. Is that what you went through and all that? Now they understood well. But when I had it,
they didn't really get it.
I think my second diagnosis, my first daughter actually, she's grown up a little bit. She understood a little bit. Yeah. Then my friends and family, they were very supportive. My church, my former church, I used to go to King's Church in town. They were very supportive. I give it to them. They were always cooking financially, emotionally. No, I had massive, huge support. Yeah, support system. Good. Yeah.
Oh, that's really good. Wow. Okay. Wow, that's so strong. So I want you to say something what would you say, like to women generally? What advice will you give about being proactive? Because you've said that the early detection has really helped you. So I want you to empower people, like we women, like what should we do to check? What are the tools? Where can we go to find information about, what are the signs we should see that we shouldn't play with?
So, the NHS England, they don't offer mammogramming to younger ladies. I think they start mammogramming from 50 years upwards. I can't remember. I think I did a research. But then again, there's another tools where you could check. Just simple, when you are in the bathroom, just check your breast, the cancer doesn't just, especially with on the boobs, some goes under your axillary. So just check. Anytime you see unusual stain in your skin or lumps, just go straight to the GP. They act very fast. They will refer you straight to the breast clinic. They act very fast. Because GP has referred you, they will offer you mammography because they don't know what's going on in your system. They need to check it properly. So the earlier you check, the better for you. Because most, especially our African community, most time what kills them is the delay of finding out if they actually have the cancer cell. Some people will just be praying, God forbid. See, manna will not fall from God, from heaven. Yes. You have to help yourself. I believe in prayer, I believe in miracle, but then again, you have to help yourself before God can actually help you. So because if you don't, obviously there's no way you can pray. I don't say I don't believe in God or I don't believe in miracle. You have to, the surgeon or the doctor, they have to do their work before God can intervene.
Yes, to heal you. So people need to be proactive.
They have to be proactive. So
it's everybody's responsibility.
Yes.
Just check your boobs while you are in the shower.
That's it.
Check your armpit
while you are lying down.
Yeah. And if you see something that doesn't look right,
Just
go
go straight to
straight to your
GP.
GP
They will
and-
listen to you. Yeah.
Okay.
Yeah.
Oh, that's amazing. Thank you, darling. That was really good. So, ladies, please, let's not sleep on this. Life is too sweet, too fun. There's so many places to
Honestly,
explore.
life is too sweet.
Things
I love
to
life.
enjoy that we
I love
cannot
life. Yeah.
afford
Yeah.
to be careless with it.
Yeah.
You know, you can get a new house, get a new car. You know, you cannot get a new life. Life is the
Never.
only thing you can. You can even if you lose an arm, a leg, a limb, you can get an alternative. It might not
Of
be
course.
real one, but you could get something.
Mm-hmm.
But once the breath is gone, psh,
Yeah.
you know, so let's not sleep on it. Thank you so much, Amaka. That was really, really amazing. Thank you for that story. Now let's lighten things up a bit.
Okay.
So I know that you are a Jala traveler. You can't. Every time I look on your status, I'm like, oh my God, where is coming? Where is this girl going? So just off the top of your head, tell us the last 5 countries you've been to.
So this year alone, I think I've been to 6 countries. So
Okay.
I started up with, in February, I took my kids to Egypt.
Ooh.
Yeah, I really enjoyed that Egypt. It was
amazing.
It was amazing. Then in April, I went to France, Paris with my cousin.
Oh, nice.
Yeah. So yeah. Then in May, I went to Portugal.
I love it.
I went to Portugal. Then in June, obviously went to Nigeria because I've not been to Nigeria for a while now. Then I think in September, no, August ending. In August ending, I went to Milan all by myself,
Having fun.
having fun. It's September. I went to Greece.
Wow,
Yeah,
wow.
and I still have one more
And
trip
one more
to go
before this year runs
before
out.
this year on.
Oh, that's amazing.
Yeah.
That's amazing. Oh
Yeah.
my God, I love it. And so give us one fashion tip, because I know you're a fashionista. You know, you do your things, you put your fashion together. Give our view. So in this fall season, what is one fashion go-to that you would say that ladies you must have?
Oh, definitely blazers.
Yes.
Blazers is just,
They're in.
you can't go wrong with blazers.
Mm-hmm.
A very nice pair of jeans.
Okay.
You can't go wrong with a very nice pair of jeans.
Perfect.
Honestly. And a nude sneakers. You can't go wrong with a nude sneakers. Honestly, you don't have to do
Too much.
Yeah.
Yeah. Be cutesy.
That's it. Yeah.
That's brilliant.
Yeah.
Okay.
Yeah.
Now I'm going to ask you one more question. Well, 2 more questions, but one
Okay.
more. First one. Eba or Pandanyam?
Yeah, I don't do swallow.
Hey, I like
Honestly,
it.
I don't do
Do you eat
swallow.
rice?
I'm more of like a snacky person.
Okay.
I don't do like
Proper meal.
meal, and it's helping me with my,
You know your weight and
my,
you
yeah.
You look very good.
Yeah, I don't do swallow, but I eat rice, but no,
Not a lot.
not a lot. Yeah.
Okay. Are you a fish person or a meat person?
Both.
Okay.
Yeah.
Okay.
Yeah.
Okay. Nice.
Yeah.
And tell us something you've not told anybody before. Give us a secret. We like gisting. This is the gist table. Tell us something.
Okay.
It might not be a secret, but you've not shared it. So tell us that.
Right. So during my training as a nurse, in my 2nd year, something happened which I will later tell the story, but not now.
Okay.
So I felt like I was gonna drop out.
Wow.
Yes, just at the middle of my training, I just felt like I was gonna drop out. I was like, that was the end of the road for me. You know, I remember that night crying like, oh, who's gonna help me with my child minding? Because you know, nursing is 50-50.
It's intense.
Very intense. You have to do
know.
placement, you have to, you know. So then again, I pulled through.
Wow.
Yeah, I pulled through. God sent someone, like an angel, to help me. I pulled through and I finished.
Oh wow.
Yeah.
Well done. Honestly, you embody a strong woman. You embody a feminist. You embody somebody that's not going to roll over and let life just do them.
No.
And that's so inspiring, and I hope your story touches, even if it's one person that your story touches, then it's delivered the purpose of why I even have this platform.
Yeah.
Because the inception of this platform for me was I want to create a space where people feel free to share their journey, to inspire and empower other people, and to make it feel real. So regular people, it's okay for a celebrity to say this, but sometimes we feel celebrities are not attainable because they are so, you know what I mean? But when you hear a regular sister, a regular brother sharing you a story, I find it is more relatable. So Amaka, thank you so much for coming on the table. Thank you for sharing your time.
My pleasure.
Thank you for sharing your story. We the Gisters, we love you.
Oh,
You're such a strong woman, and I'm just gonna give you a hug. Honestly, you're great.
You.
The first hug on the table.
Thank you.
Oh, honestly, your story was so touching and inspiring. Right, guys, you've heard it. That's Amaka's story. And if you want more information, if you're not sure on how to check yourself, we will provide some links that would send you off to the NHS sites. Go and have a look on there. There's a lot of materials on there about breast cancer, how to check yourself, how to make sure that things feel right. If you do check yourself and you feel things are not right, the steps to do, contacting your GP and all that kind of information. I will source the web, find those links and attach it to these videos. Thank you so much, guys. Till next time, toodles!
Bye.